Hello everyone, I'm Dr. Merry, and I'm the supervising psychologist of Life Care Centers. Today I want to talk about a very important issue, something that's been giving a lot of airtime in the media these days, and that's the whole topic of depression. Depression is something that is probably one of the most common things that come through my doors, but the sad thing is that a large majority of people who struggle with depression don't actually walk through my doors. And as Christians, there is some wrong theology about depression. So people who desperately need help don't get the help that they need, and they just beat themselves up and think that there's something wrong with them, that they're not joyful enough, that they're not experiencing enough gratitude, and it's their fault, and they're somehow having a sinful attitude and they just got to snap out of it. But depression is a very real phenomenon. There are actual studies that show that the brain of somebody suffering from depression, actually the brain patterns look different. There's things going on that's physiological in nature. And with that, it's not something that they're choosing to experience. And so it's so important that people who are struggling with some symptoms of depression come and get the help that they need. So some of the things to look for with depression, and it can look so different from person to person. I could meet you and you could be struggling with depression and I might not see it. Although as a clinician, I might pick up on some of the symptoms of it. But people will often experience things such as low motivation, low energy, difficulty sleeping, sometimes racing thoughts, sometimes sluggish thoughts. I mean, you kind of have the variety of things. Often it's just an inability to feel any joy anymore. Sometimes it's crying without stopping. Sometimes it's emotional numbness. So you can see there's some extremes with that. So it's not one size fits all with depression. If you're finding that you're somehow not functioning to the best you can in life, and of course even the very real danger that maybe you're even feeling suicidal on top of that, then please get some help. Don't beat yourself up, get the help that you need, and help is out there. There are very good things that can help you manage your depression. Now there's other forms of depression. That one's more sort of physiologically based. Now there are people who experience what we call situational depression, and that can be because they've just gone through grief or some terrible loss or some difficulties in their life. So high stress can lead to that. And so you end up finding yourself in a state of depression as well. And rather than just trying to talk yourself out of it, again, give yourself permission to say, okay, I'm not myself. My friends are starting to notice, they're commenting on things. And in fact, one of the symptoms of depression is withdrawing. You know, you could be formerly very outgoing, then all of a sudden you stop wanting to go to outings or parties. You're not enjoying going to church. You're hanging out at the back, or you're not even going anymore. So that's one of the signs. So as a family member, if I'm starting to notice that in my kids or in my spouse, then it's time to start to pay attention. Something may be going on, and telling them snap out of it is not helpful. So that's really, really critical. And with depression and getting the help that you need, it is a journey. Many times people struggle with depression for years before they get that help. Sometimes there's underlying unresolved trauma that leads to depression as well. There's just this overriding sadness. And so it's very important to identify kind of what's underlying the depression and get the help that you need. And giving yourself the space and grace. So it takes time, like I said. I wish I could just give you some pills or some magic 10 steps and somehow you're going to snap out of it. Often the recovery is going to take a little bit longer. And sometimes there's a physiological basis as well, and that may mean medication. It may mean a change in your nutrition, exercise, your sleep habits. I mean, those are all the things that we look at getting things back on track when we're helping people deal with depression. So it's really key. As I said, back to my point about the unresolved trauma, that is often more significant than people realize. So what we do at our center with trauma therapy, we use a number of different techniques, but with trauma therapy, we will often use what we call nonverbal techniques, because when somebody's feeling depressed, they can't always put into words, or when they're experiencing trauma, they can't always articulate specifically what's going on. And by the way, when you're articulating, it kind of goes into the logical part of your brain, and trauma kind of tends to reside in the emotional part of the brain. So for example, we do stand tray therapy, and that's something that men actually really like, because you get to play with figurines in the sand, but your story is told through the figurines in the sand, and that's a very, very, very powerful way of doing trauma therapy. We also do something called EMDR, and that's working with the way the brain processes trauma, and it's been found to be highly, highly effective. I mean, it was first used for war vets. That's how effective it is. So those are some of the techniques we use around trauma therapy. But we also look at what may be some underlying causes of the depression. So beyond the trauma, there are some other things that could be going on. So for example, many times there's undiagnosed anxiety, and anxiety is actually the predominant flavor of what's going on with the person. Think about this. If you're so anxious, you're constantly worrying, you're not getting any sleep, you're not eating well because you're so anxious, you're feeling completely overwhelmed, you do get to a place of hopelessness, like I just can't cope with life anymore, which can then trigger into depression. Sometimes it's just having so much stress in your life, thing after thing, go, 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 that can also lead to symptoms of depression. So it's important to identify some of those things so you can be gearing your treatment towards that. And some of the really great treatments that we have found to be highly effective with depression as well as anxiety. Cognitive behavior therapy has been around for a long time, and that's about helping to capture your thoughts and to change them appropriately. But we actually also pair that with something called dialectical behavior therapy, and that is awesome because it does use some of the principles of cognitive behavior therapy, but goes beyond that. It teaches somebody how to tolerate distress, how to even know how they feel, identify it, how to be able to express it, how to regulate their own emotions, and how to handle stress. I mean, it's lots of very practical skills. So, often with a client, we might do some of the trauma work, but we will also do some of the CBT, what we call DBT. Those are the names that we go by that. So that's kind of some of the things that we do. So just as you can see, there are just some very practical things that can be done for you. And so if you're listening and you're starting to think, maybe I'm kind of struggling with depression, please know that there is hope and there is help for you. Seek out professional help. Get a referral from your pastor to some reputable Christian therapist who knows what they're doing and knows how to treat depression. And in the meanwhile, I can't stress this enough. Please recognize that there is no shame in experiencing depression. It is not something you chose to experience. And your friends may tell you to snap out of it and think more positive thoughts, and I'm sure you try. But depression is a very real ailment that people struggle with. And so recognize that you can go to your Father, to God, and you can be completely vulnerable. He's not going to reject you. He's not going to shame you. He's not going to condemn you. He sees you as you are, and He knows you're suffering. And when you do that, when you give yourself to God, He will hold on to hope for you, and He will lead you on that path of journey, that path of healing that He wants you to follow. He's going to bring people into your life. He's going to trigger you to make that phone call to that counselor that you've been meaning to call for years. And just do it and get some help. There is hope. There is healing.